Hello everyone. Welcome to our monthly Collective 365 webinar with Sitrion. Today we are thrilled to have Health South join us to share how they embarked on a journey last year to figure out the best way to communicate with their large growing workforce using their mobile devices. The challenges they were trying to solve are universal to everyone. I'm willing to bet most of you on the call today. Those obstacles include struggling to reach employees when and where they want their information, measuring the reach and impact of your internal communications, cutting through all the noise, and catering to an increasingly mobile-savvy workforce. So today, they're going to take us along on their mobile journey and share with us the steps they've gone through to effectively reach and engage all their employees, starting with focus groups to vendor selection to product pilot to rollout to their results so far and their plan for the future. Before we get started, though, I would like to just go over a few quick things. We are recording today's webinar, and we will be sending out a link to everyone with a recording and the slides from today within about 24 hours. And throughout the session today, if you do have any questions, please submit them through the chat window, and we will try to address them throughout the session as well as at the end during the Q&A. So let me begin by introducing who is joining us today. Alyssa Hagan currently serves as the Internal Communications Manager at Health South. Through timely and creative content development, her team manages the variety of communication channels to reach the company's 30,000 employees, most of whom are non-wired hospital-based clinicians. Also joining us is Lindsay Jones, who leads the internal communications function at Health South. In her role, she provides counsel to senior management and corporate departments to effectively inform and engage their 30-plus thousand coworkers across 24 states, guiding employees' alignment with strategy. My name is Jen Kierlieber. I'm part of Sitrion's customer success team I'll be moderating today. I have the privilege of working with our awesome clients like Health South. Lindsay and Alyssa are truly pioneers in the area of providing their large distributed workforce with an employee mobile app that not only reaches and engages everyone, but it also helps them get their job done better and easier. So without further ado, I would love to hand things over to Lindsay to get us started.
Thanks, Jen, and good morning, everyone. The first thing I wanted to do was to introduce you to Health South a little bit more. We're one of the nation's largest provider of post-acute healthcare services, offering both facility-based and home health post-acute services. We recently acquired a company named Encompass that was expanding our home health presence. That was in 2014, and they're growing as fast as we are. The context that I will speak on today is on the inpatient rehabilitation side. We've recently undergone numerous acquisitions. In 2015, we're expecting to add 200 beds this year between acquisitions and different de novo projects. Then in 2015, we saw an 18% increase in beds, which added about 4,000 employees to our base. Because of this, we feel like we've developed a solid internal communication strategy, and we feel that initiating an employee app is a great way to reach our existing and some of those new employees. So on to the next slide. The question, I guess the elephant in the room for us when we started this project is why an app? And we felt that it hit two major things. It helped us overcome some of our communication challenges, and it also helped us prepare for the future. So our current channels right now, they have a very solid foundation. They're evolving consistently with employee feedback. Employee listening is something that we do a lot of. But some of our methods and some of our existing channels presented a number of key challenges. We have a diverse audience with different backgrounds, and how do we best communicate with them? We wanted to provide a channel that combined company information with local hospital information, and we wanted to help our corporate departments communicate better to employees, and we wanted to be able to measure the success of our channels. And then also the unprecedented growth that I've mentioned and all the communications going around that stretches our small team a little bit thin, so we thought an app would be an efficient way to communicate. To prepare for the future, we felt that the app supported our internal communication strategy and really helped us with that targeted communication and with that business outcomes focused measurement. And we felt the app was a great way to prepare for the future and overcome those challenges.
All right. So today, we know that on average, people spend about 3 hours daily using their mobile device. So an app is an opportunity to reach employees in a familiar space. So in our session today, we'll discuss our journey to an employee mobile app, including our research tactics, a phased rollout approach, and we'll also, which I'm sure is the reason why you're here, sneak a preview of the app in the middle to show where we are today.
All right, we began our mobile journey in 2015. At that time, only 35% of large companies, which would include ourselves, were planning to develop or deploy an app. So like Jen mentioned, we felt like we were pioneers in this space. Our process was multi-phased, and our first steps were to determine our stakeholders, those who needed to reach employees with key messages, as well as our employees who were the end users, and then the desired function and the optimal platform to address those needs. So the first thing that we did was pull together some focus groups and had a design strategy meeting. I'll go through the process quickly following this slide. But we wanted to make sure that we were choosing a technology option that kept the user experience and IT security at the forefront. So we held 7 focus groups initially to learn more about the opinions of our employees. We learned the preferences and the channels they naturally use, what's convenient for them, and mobile emerged as that solution and continued to support the journey for our app. We looked at vendors. Some provided off-the-shelf solutions, some could build a custom app, and others could do both. We determined that an off-the-shelf vendor would by far be the best solution to meet our enterprise needs. They would keep us on track with software updates, they would provide an easy admin interface, and other functionality for security and monitoring. From there, we had our goal and our vendor. We chose Sitrion because we truly felt that they were a partner in developing our app, and they have held true to that through the entire process. And then our goal was to be an easily accessible communication channel connecting employees to company-wide and hospital-specific information. So from here, I'll turn it back over to Alyssa, and she will show you 3 of the key features and provide a preview.
So I have to say, this is our baby. I am so proud to show you our employee app. It was born from employee listening, as Lindsay mentioned, and our need for new ways to capitalize on mobile communication, as well as BYOD, or bring your own device. Today I'll show you the app's key features and then dive deeper with a live demo. I'd also like to note how we came up with the name for our app. After additional employee feedback from our pilot hospital, we named it Hive to represent a community buzzing with activity, much like our hospital environments. Plus, the fun theming offers a variety of ways for our hospitals to market the app. We've seen bee costumes, cupcakes, flyers, and more to encourage employees to download the app. Version 1 of our app is a minimally viable product, or MVP. We wanted to keep it fairly simple to not overwhelm employees with too many bells and whistles and ensure the features we did offer delivered. The app currently includes, which you can see a screenshot here, a news feed. It includes timely content that my communications team can push out, including wellness information, company-wide deadlines, educational resources, and more. In the same feed, hospital delegates, or our human resources directors, have the ability to push hospital-specific content to connect their employees with local and more personal content. This could include upcoming events, employee birthdays, hospital town halls, cafeteria menus, etc. We also have a resource library which places helpful links such as remote access, healthsouth.com, our external website, the employee referral program, as well as employee benefits information in the palms of employees' hands without logging onto our HealthSouth network. It's a great resource to access information whenever they need it. The My Benefits section, which is our most popular feature, is populated with employees' benefit selections, providing access to PTO balances and benefits information for items employees are personally enrolled in. So it is customized to their personal profile. Our first version has been nominated and shortlisted for a couple of industry awards. This has given us great exposure with our executive team and our peers. So now I would like to show you a live demo. I can pull this up. here comes my iPad. All right. So this is what our app looks like. This is the news feed, or Sitrion's product calls it the hub, but we termed it our news feed. You can easily see the different content that we're posting. We can recognize employees. We can give IT updates, any sort of content that is helpful to employees. We did discover through our pilot that they wanted wellness information, educational information, anything related to our company-wide goals we can also push out, as well as because our employee newsletter, which goes out weekly, is living on the cloud, I can include a link to get to it directly versus logging into their employee email. So there's a lot of great things we can do here in the news feed. There are also, you'll notice, some social features. So for example, on this, the latest issue of Messenger Post, you can see that 2 employees have liked it, which is great. We're great that they're accessing the newsletter in this space. If I click through, or just click on the post, you can see where an end user can like the post as well as leave a comment. We have had some comments since launching. Most are related to any incentivized posts, like share your comment about your favorite feature and you'll get some sort of incentive from the hospital or from us at corporate. The Services tab at the bottom is where I can also access the benefits elections information, which here it is. You can see my PTO, the benefits that I have personally elected into. This syncs up with PeopleSoft every morning. And so once an employee downloads the app, they'll be able to see all of this personal information later. So I will note that it is not anything confidential, being that this is on employees' personal devices. There's also a place where I can select which channels of content I want to follow. You'll see that there are mandatory channels, including company news, My Health South, and wellness. The local news channel is also mandatory, and that's where all of our human resources directors can post hospital-specific content. So the employees always know that anything coming through that local news channel is just for them. They can also toggle one of these, any of these buttons here to elect to see notes about education, IT tips, as well as a job openings feed. The resource library that I mentioned includes documents and links to external websites. The documents are housed in the app, so that's simple and employees don't have to log into a network or anything to access them. We've included a benefits summary as well as helpful benefits contacts with clickable phone numbers and websites so that they can easily get to maybe the customer service line for Blue Cross Blue Shield, who is our healthcare benefits provider. So that is the main portion of the app. There's also a settings area where employees can update their profile, add a profile picture, elect to receive push notifications, change their password, and more. That's what I'd like to show you there. If I can. Okay, so let's get back to the presentation. All right. So now that you've seen our app, I would like to briefly go through our strategy behind the phased rollout and the pilot approach so you can really get to know how we got to where we are with those features and the specific content that we are distributing. I'll also discuss feedback received as well as current adoption stats and our next steps. So first off, before we launched company-wide, we tested the app for 6 weeks with a pilot hospital in Sarasota, Florida. I visited the hospital in person to train super users to act as peer advocates for the app and brainstorm other adoption ideas with the hospital human resources director. When creating the app, we wanted to ensure the end-user functionality and features were enticing, but also that it was a tool for the HRDs to make their job easier, to better reach their employees with important and wanted information. Here you'll see a screenshot of the app prior to the Hive branding. We waited to get feedback from the pilot employees before selecting the name. But that is a screenshot showing you what the HRD, Marvi, was able to send to her employees through the local news channel on the app. Following the pilot, I went back to Sarasota to regroup with the HRD and held a focus group to learn improvement suggestions both for the content management system that she uses as well as the end user features of the app. Here, we mainly learned about the types of content employees are most interested in, including clinical education opportunities, employee retirement parties, and simple things like the weekly hospital cafeteria menu. We also heard a lot of employees say how much they appreciated quick access to their benefits information without having to log into a computer connected to the company network. So here's some stats. So we are in the very initial phase of the launch of the app. We've held a pilot and launched in 4 out of our 6 operating regions, which are included here in the bubbles. We also have plans to roll out the app with our corporate office, but with a very different use case. Our initial measurement tactics focus on adoption and which content performs well. For adoption, we know that our user experience is top-notch, not only for employees, but for our admins in the hospitals. You can see where we are based on when we launched in each region. So those that have launched a little while ago have had a lot more time to get to that closer to 500 downloads, 250 downloads, you can see. Each region, the reason the percentages are a little different is each region of hospitals has a varying number of total employees. As new adoption tactics, we're planning to use our established super users in the hospitals and give them tools as well as incentives to act as champions for their peers to continue to reach our goal of 20% adoption in each region by the end of first quarter 2017. And we're also going to enable a refer a colleague feature to help them to really push out the app and share with their coworkers. For content, we're seeing a good mix of popularity around local content as well as large company announcements, and we'll continue to monitor preferences. As we've implemented our phased rollout of the app, we've continued to listen to employee content and improvement suggestions, adding snapshots of likes and comment counts in the news feed versus just the full message, enhancing the content management system for the HRDs, and more. And as I'm sure that many of you are aware, with any new project can come negative feedback. So while this project has been widely received and hyped up, I'd like to share some feedback we've encountered simply as a word of advice for you all. Much of the negative feedback we've seen stems from user error. That has been a major learning experience throughout this process. While most people have smartphones, everyone has a varying degree of technological savvy. Our advice here is to make your download and registration steps as simple as possible and be very patient and responsive to questions so that you don't discourage any employees from abandoning the app based on a poor initial experience, even if it was their fault. As we finish the rollout with the rest of our hospitals, we will continue to listen to employee suggestions. But at this time, we see the next steps for our app including additional micro apps, maybe PTO requests, an events calendar, a survey tool, or discussion forums, further integration with company systems, which may be part of the selected micro apps, specific corporate use cases, hospital acquisition use cases, and ways to impact employee performance related to business outcomes. As you think about heading down the mobile path at your organization, we hope our case study will help you to consider the importance of research, listening to various groups of employees through focus groups, pilot testing, and periodic check-ins. Also, think about your design strategy. What is your minimally viable product that will give you the biggest bang for your buck without overwhelming employees? Also, a phased rollout can have many benefits, including the opportunity to fix any last bugs employees may encounter, add minor functionality improvements, and simply buy you time to get all employees on board. We have 30,000 employees at Health South, and the idea of giving them all the opportunity to download the app at one time was a bit scary. Unless you have a large team to assist with content creation and adoption troubleshooting, a phased rollout is highly suggested. Mobile technology represents a fantastic opportunity to boost the value of internal communications as a function at your organization. Content popularity and user interaction can easily be tracked, helping you and your key stakeholders and executive management know their messages are being received by employees. When employees can engage with our communications, it's good for us, good for them, and good for our company. So with that, we'd love to open it up for any questions that you may have on anything you've seen today.
Awesome. We definitely have some questions coming in. What was the biggest technical barrier you overcame?
I would say the largest technical barrier was actually related to our company's security. If you're talking about launching the app. If you're talking about the savvy of the employees, I would say it's just a lot of them, since they are not on a computer all day, just don't really know how to access the things that they need. So getting them on the app is key, but once they download it, then they might have some difficulty in finishing their registration. Related to the security piece of it, though, for launching the app, it took us a little while to really connect between Sitrion, the vendor, and Health South and come to a great place of understanding how we can connect with our employees through the app, but without connecting to our Health South network, because we are a healthcare company. There are HIPAA policies and other things where we just didn't want any personal employee data or the potential for patient data to be shared somehow by connecting personal devices that employees own to Health South data and other things.
Awesome. We have lots of questions coming in. Have you, let's see, some of these are definitely metrics related. Actually, let's do this one. How long did it take you to move from concept to implementation of the pilot? How long did your initial pilot last?
I'd say it was 12 months of listening to employees, talking to our stakeholders, working with IT, from concept to having the app ready to pilot. The pilot was 6 weeks in Sarasota, and we were in continual contact with the HRD at that hospital to see how it was going and how employees were downloading the app, adopting the app. So it was a constant conversation then so that we could pause for another moment after that pilot and make further tweaks to the app.
We waited another almost 3 months after the pilot to implement those changes before launching with an entire hospital region.
Okay, awesome. So one here too is, are the devices that everyone uses owned by the users? So I guess along the lines of your BYOD policy. And then in the same kind of vein, why choose Sitrion and not develop your own app? And I know someone else asked how many vendors you looked at too as well.
Okay, so there were a lot of parts to that question.
Yep, sorry.
Okay, sorry, what were I think there were 3 key. It was why, or how many vendors?
Yeah, well, we can start at the beginning. What are the devices that everyone is using at your organization? And I suppose, what type of BYOD policy do you have?
Okay, so we only have, out of our 30,000 employees, there's probably about 2,000 that have a Health South device that they are absolutely welcomed to download the app on. For the rest who do not have a Health South device, we asked that they use their personal device, whether it's a tablet or a smartphone. That's really the extent of the policy. We didn't have anything really written. It was just download the app and get involved. We did have terms of use, though, where we discussed for any of those hourly employees, sort of compensation, and how at this time our term is that employees will not be compensated for any mobile data usage or accessing the information outside of their normal working hours, because this is an optional tool and it is just up to them if they want to stay connected in this way.
And then for the questions around the vendors, we looked at 8 solutions initially, and those included off-the-shelf, hybrid, and custom. We ended up, of those 8, we brought 3 on site to our corporate office to do presentations. At that moment, after that, we went back to IT and had some very candid conversations, and they were very frank with us and told us that they would not be able to support a custom app and strongly recommended not going down that road because we know how quickly technology becomes dated. So we would constantly either have to, within our own IT infrastructure, or pay the vendor to continually update to keep up with the different iOS updates and other things happening in that space. So at that point, we knew we wanted to go with a vendor that had off-the-shelf capability and would support updates. So from there, we looked at 6 other off-the-shelf vendors. We didn't end up bringing them to our offices to have conversations. We felt that we were getting a good grasp with many, many conversations on the phone. From there, we did select, we narrowed it down to 2, and I think we even had more conversations. And we honestly felt that Sitrion was invested in our success of the app just as much as we are. We knew that they would work with us. We presented our different use cases, and then our team would go back to the developers at Sitrion and say, could we do this? Why would we want to do this? And I feel like Sitrion really kept us accountable to make sure we were doing things that would drive business the entire time, or that just made sense. So we feel they've been our partner through this. And they didn't ask me to say any of this either.
And I will add to that too that since then launching I don't want to use the word final product because it is always evolving, but since launching the product with our hospitals, Sitrion has come back to us and asked for input on, hey, we're working with some other clients. I know that your use case is going this direction. What do you think? How else could we improve this? So they really have been a partner in this, not just a vendor.
Does that answer?
Absolutely. Yes,
okay.
It does. Thank you very much. We have one here saying we have some clinical workers, nurses, et cetera, and non-clinical. The clinical workers are caring for patients most of the day, as you know, with little access to desktop computers. Do you find that specific job roles use the app more or less than others? Maybe your executive team versus clinical versus non-clinical?
At this time, because of the way that we are syncing with PeopleSoft, we cannot see which job roles are downloading the app or interacting with the app. That is on the top of my list for enhancements for 2017 because that would be the most important thing for us. Because most of those employees are not in front of a computer, we know that we're trying to reach them, but I would love to see which content they're better interacting with, what other content they'd like to see. So unfortunately right now we can't track that.
And that's something that we're looking to do within all of our communication channels, is to be able to segment more and watch how our different disciplines use and access company information.
Do you also offer the web version, the interface, for those people who are actually at a computer yet?
No, we do not. We want them to be in the mobile space, accessing it on their device.
When you rolled out the app, were you there in person at all facilities, or did you leave it up to the people on site to begin the rollout?
We have 123 facilities, so I have not been able to make it to every single one of them. I would love to, but that would be a full-time job. So no, I went to the pilot hospital, and I've also done a couple other focus groups and sort of helping sessions in maybe 3 other hospitals, and we have one next week as well. However, I do hold webinars with our human resources directors and anyone else that they're delegating at the hospital, maybe their CEO, to send messages. I've been doing training webinars with them as we roll out to each region. So I actually have one tomorrow with the next region that's rolling out. And that I've been able to not only demo the app, help them with any downloading concerns, but also show them a toolkit that I created for them of how to create content. Here's some tutorials on how to post within the content management system. Here's how you manage your users. How do you manage and maintain comments and monitor those? So really providing resources to the folks that are sending the messages and making sure that they're comfortable so that at the end of the day, it's successful in every single hospital.
And then we hope that our super users are our eyes, ears, feet on the ground in the hospitals. And as we continue to develop the list of all the super users, we hope to reach out to them periodically with updates or just different adoption tactics and incentives for them to help us, and then we can help them too. We hope it's a relationship.
Yeah, that's a wonderful idea. Here, we have how useful and easy have you found the metrics to help you understand engagement? And do you have any particular KPIs that you're tracking to see if you're increasing productivity?
So right now we haven't been able to link anything to employee productivity. Right now our strategy around the app is communication. We're trying to just get important information, both company information as well as local information, into the employee's hands.
So, I'm sorry to interrupt, so that they can see where they fit within the company's overall strategy. I think that's the first step in getting them to adopt this app.
Mm-hmm. So related to the metrics, what I can see though are which, like I showed on the slide earlier, which content is top performing. And if it's my content that I'm sending, that's okay, that's great. They're getting, you can see the detailed views is whoever clicks through the message to read the whole message that was posted. So I can see that my content is helpful to them. It's the company-wide information that top dogs here want people to know. But then I can also see, for example, that Albuquerque has the highest rated post so far that most people have viewed and have commented on. So I can really help the hospitals and learn from them on what content is most helpful to their employees. I can help other hospitals to put similar content, or I can tweak our company-wide content to better reach those people.
Right now we're basically creating a baseline, and then from there our plan is to go in and look at KPIs and identify ways where we can show that alignment with where the business is going.
Yeah, that totally makes sense. So here's some about your super users. Did you select them, or are they just surfacing to the top and you're nurturing them? Have they been provided any incentives so far?
Any incentive for them would be at the hospital level. We've asked the hospital delegates and human resource directors to identify 8 to 10 of them at each hospital and then send me the names of those people so that I can further engage with them. But right now they're just a helping hand in the hospital, and so any incentives to participate as a super user are provided at the hospital level. I'm sure I will do more with that company-wide once we get rolled out with everybody.
Mm-hmm. Yeah, definitely. Here's a great one too. How did you provide or prove, ROI in order to get this green lighted? And did you encounter any initial resistance from upper management or key support departments?
We have a very the app started interesting enough. Our CEO, I believe it was in a town hall meeting, mentioned how great it would be if we had an employee app. So from there,
he thinks it was his idea.
So our ears perked up during that meeting, and we said, okay, we need to start some research. And that's really what kicked us off, I guess 18 months ago or so, when we started going down this journey. So we didn't have quite as much of a burden as some, I guess some of our peers would have in selling an app up the supply chain. But what we found is that the more meaningful conversations we can have with our executive team and senior management and prove the value of our work, then the less likely they are to resist change, like this, for example. So it wasn't a hard sell because I feel like they trust us and they felt that we knew we were going down the right path.
That doesn't say it was kind of scary when we showed them the final product, and of course they had questions and enhancement suggestions themselves that were almost immediately implemented, but it was great for them to be able to see the fruits of the labor and what they thought was their idea come to fruition.
That is definitely key. Here's one. Do you have an intranet, and did you consider using it as a portal to this app?
We do have an intranet. I bet there are many of us on the call who don't think their intranet is as good as it could be, and I'm using very nice words there. And we didn't want to create a mini intranet. In some of our initial documentations, that was one of the things that we outlined, is that we didn't want the app to be that. We wanted it to just give key functionality to employees in the palm of their hands that they might need outside of work on the weekends or at night, as well as information about the company. And also, you just brought up something.
Yeah, the security aspect too. Our IT team was not very keen on linking up with the Health South network in any way, because our employees are having to use their personal devices to download the app. So that kind of brought a barrier, and we just said, based on the research that we've seen, and if IT is not willing, let's just go a different route.
Okay, here's one about admins. So in general, how many admins do you have across all the hospitals, and how have you seen so far whether it's easy or difficult to use the admin center to post cards and videos and photos and content?
So we have, since we've only launched with 4 out of our 6 regions, we have, you can see on this slide, the participating hospitals. So those each have 1 delegate at those participating hospitals, the HRD, and then if they've requested to have anyone else, maybe from their leadership team or an administrative assistant, I would say it averages about 2 delegates per hospital that are using the content management system. And the feedback that I've received is that it's very easy to use. In fact, we did that on purpose. I highly stressed to Sitrion that we need this to be as simple to use as possible, not just for me. I could learn anything, I'll do my best, but because the hospital folks have other jobs outside of communications, this is just a small piece of what they're doing. So the functionality, I have not had a single complaint about the functionality for publishing content, or even monitoring their own comments on their hospital content, because that is their job. Anything they post, they need to make sure is being engaged properly. But otherwise, it's all been great.
Yeah, and after the pilot, the tweaks that we made were mainly to that admin console, making it easier to use at the local level. And then Alyssa has also really done a great job putting together a toolkit for them to use, and that is on our intranet. But she has images that they can grab. She has helpful tips and other resources. So we've tried to remove any barrier that we've identified to this point to getting them on board to use the app with local information, because we know that's key to getting to driving adoption, is having that local component of it, so it doesn't feel like it's just corporate pushing down messages.
Along those same lines, someone's asking too, how often are you pushing content, and are you giving them any type of best practices in that toolkit? Are they planning content in advance, or maybe you are from a corporate level, but maybe not from a local level?
I definitely plan content in advance. I plan a whole month out at a time, though I can schedule content in the app. That is a great feature that I haven't mentioned. I plan the content a month out, but I schedule it once a week and check comments made on the company-wide content at that same time. I can also easily go in and just add any content at any time if something big comes up. The hospitals, the advice that I have given them is to post when it's convenient to them, because like I said before, it's not their top job. While communication in any organization is a huge priority, it's just not at the top of their list. So I have shown them how to schedule content, given them sample communication plans so that they can map out content and just schedule it all at once. Maybe there's an event coming up and they can, plan out event reminders, things like that. Try to include that in that toolkit as well as on those webinars when I've been launching, just so that they fully understand that this is something to help them do their job, not just another task.
And then at a minimum, Alyssa is posting once a day, even on the weekends, because she's scheduling it out in advance. So there is something fresh every day on the app.
And I would say, from seeing what the hospitals are publishing, Some are more engaged than others. I've seen some post maybe once a week. I've seen some post every day. If there's a big campaign going on, for example, in September we had National Rehabilitation Awareness Week, which is huge in all of our hospitals because rehabilitation is what we do. And so they were all posting pictures of employees and exciting events. Come to the cafeteria for a cupcake, things like that. They were posting multiple times a day and using the app for what it's for. Reach those employees, get them to come to your events, give them the information that they want.
That's awesome. I'm impressed that you have a month out planned. I'd love to be able to do that. I think that's the questions we have for today. We have some more coming through, but I think we're going to try to reach out to them afterwards because I don't want to go too long here and keep Alyssa and Lindsay too long. So with that, I would like to wrap up and thank you both so much for joining us and sharing all of this wonderful information. Like I mentioned at the beginning, you are truly pioneers. We're greatly appreciative of you sharing all your learnings with us today. Keep up the awesome work, and we can't wait to see even more wonderful things coming in the future.
Great. Thank you so much for having us, and the questions were great. Thanks for all the participation.
Definitely. For everyone else, thank you for joining us as well. We hope you learned a lot, and perhaps Alyssa and Lindsay have ignited a lot of ideas in your head today. If you're looking for help when it comes to building your business case for reaching and engaging all of your employees, we're definitely here. We encourage you to reach out. We're happy to provide our success framework and do a workshop with you with our customer success team to help you figure out your next steps. And if you want to see Sitrion one for yourself right now, go for it. You can go to our website and download the test drive at sitrion.com/test drive. And we look forward to seeing all of you again at our next webinar in November. We'll be actually diving into this important topic of how to build a business case for mobile. We're going to share all the different use cases we're seeing with our clients, including the one you saw today, above and beyond that. And we'll give you some more information about how to make the best case for implementing an employee mobile app for your line of business or obviously corporate-wide. So stay tuned for more details. We'll send it out via email and on our website. So with that, thanks so much for joining us, and have a wonderful rest of your day.